A beautiful evening to you all, and welcome to Timeline, the program that unpacks the social issues shaping our world and where we get to profile solutions to make the world a better place. I am your host, Sharon Ajay, and as always,
Hannah Mwakafe, and I particularly like the fact that you said the program where we get to profile solutions. Let's look at solutions today.
Exactly. Well, today we'll be talking about a subject matter that is dreaded by not just women, but people in general, and that is maternal mortality crisis in Africa. We have a guest to help dissect this conversation. We're going to go on a short break, and when we return, Timeline continues. Stay with us. Welcome back. This is Timeline. Now, our guest is a public health professional. Make welcome, Juliet Asikpo. It's good to have you in the studio with us.
Thank you.
Welcome.
Good to have you too.
Okay. Just like I said, we'll be talking about a very important issue. And I specifically said it's not just dreaded by women in as much as it's women related, but it's also dreaded by people. And that's maternal mortality in crisis in Africa. Now, globally, thousands of women die, as a result of childbirth and pregnancy. And it's really sad. Surprisingly, sub-Saharan Africa account for most of this death. And that's why we are focused on Africa. Now, to give a clearer perspective, World Health Organization, in their 2023 report, that about 260,000 women died as of 2023. Now, out of the 260 women, sub-Saharan accounted for 70%. That's about 182,000 women for just that region alone. So you could see the margin. You could tell that sub-Saharan is really accounting for numerous of that maternal mortality death. And that's why we are having this conversation, to know the reason behind this, to see what solutions we can profile to, of course, help that region, right, Omokafi?
Yes, the report you just gave, to give a very clearer perspective, every single day, the WHO had reported that 700 women get to die. So you had mentioned 260,000, right? But every single day, there's 700 women who get to die from pregnancy-related cases and also childbirth. And that's a problem that we are supposed to solve, because that's we going far behind what is supposed to be happening in the world. We're not supposed to be facing such kind of problem in this time.
I would like you to explain in simple terms what maternal mortality is, because of course we know there are a lot of persons that do not understand what we're talking about, but I'd like you to explain it in layman language so we could carry everybody along.
Okay, so maternal mortality is where a woman loses her life during pregnancy, during childbirth, or about 4 to 6 weeks after childbirth. It shows how safe it is for a woman to be able to give birth or thrive in a particular region or society. And some of the factors that lead to maternal mortality are very much preventable.
One example I would give is that maternal health is supposed to be something that's supposed to be addressed by public health facilities like primary healthcare, which is supposed to be one of the tools or system used for ensuring that universal health coverage is achieved. But then yet we still get to have this problem. So what are the causes?
Okay, some of the causes that lead to maternal mortality, we have obstructed labor, we have preeclampsia and eclampsia, which is high blood pressure. We have infections and complications that rise during childbirth, which can be those infections that lead to sepsis. And some of them are preventable, like administering as little as oxytocin for the preeclampsia. And preeclampsia and eclampsia should also have been diagnosed during pregnancy, so that when it comes to childbirth, it doesn't have to result in the woman losing her life. So even unsafe abortion is part of one of the maternal mortality crises around the world.
I would like you to explain to us how poverty and maybe lack of access to primary healthcare could pose as a serious challenge to maternal mortality.
So regarding that, in design thinking, there's what we know as wicked problems. So poverty is an example of a wicked problem.
Okay.
But like when it comes to wicked problems, it has a lot of characteristics. For example, not just that one problem, it's surrounded by other sub-problems. So for poverty now, we have ignorance, we have lack of access to healthcare, we have lack of access to education, low income, low social status, and all of that. So when it comes to maternal health, as little as transportation for the woman to be able to access antenatal care or go to the hospital when it's time for childbirth can also lead to complications during childbirth. So poverty, that is an example. Another sub problem under poverty is lack of access to education or ignorance. So some of these women, especially in the rural areas, growing up, they see their mothers or their aunties giving birth at home because I believe it's in northern Nigeria, there's something called PUDA, female seclusion, where it is seen as rude or bad for you to access your maternal health service or go to the hospital or go to the primary healthcare center for your childbirth. So they prefer you giving birth at home, following the generations of your mother, your grandmother giving birth at home. That is ignorance or lack of awareness, which also is linked to poverty. So that is another factor. So if they cannot, or if they don't have the knowledge, or if they're not aware of the benefits of giving birth in primary healthcare centers, and if they don't have like the resources, if they don't have income to be able to access facility, it can also lead to some of the crises that arise during childbirth or pregnancy or after childbirth.
This particular problem is the reason why poverty is the reason why lots of African countries have set up something called the maternity waiting homes, where women who are in remote village and probably would have problems of, I do not have transport to go to this particular place to access better healthcare, or they have pregnancy complications that before they get there, the child would die or they themselves would die and something like that. And so they have this home set across very close to the hospitals, just so that when this need arises, you can stay there for a while and then you get transferred to primary healthcare systems. Now, away from that, you had mentioned something very vital, which is culture, which is related to poverty, one of the causes of maternal mortality. So how does culture play a role in not allowing people to access proper healthcare? You had mentioned PUDA, a northern home where I've forgotten how.
Female seclusion.
Yes, a northern female seclusion homes where people get to, stay there and then they're not allowed to go to hospitals and everything because they feel it's rude or something. There are other similar cultures that we have. There are other things that can also cause that, maybe like female genital mutilation and the rest. So help us clarify this.
Okay, so culture plays a very big role when it comes to maternal mortality. For example, the PUDA that I mentioned, where they feel it's rude for them to go to the primary healthcare center to be able to access health services. It affects the woman in question, let's say the mother in question, because take for instance, the woman has preeclampsia, high blood pressure, and she never ever attended antenatal care. And she never got to actually find out that she was hypertensive. And when it's time for childbirth now, complications arises and she dies. Tomorrow, some of them might not link it to that health problem. They'll still go back to culture. Oh, maybe it's because something happened. Maybe it wasn't the auntie, and generations have known that it's the auntie or the mother or the grandmother that is supposed to help her give birth to the child and all of that. So culture plays a big role because sometimes it limits our ability to have certain healthy perceptions when it comes to maternal health. And some of the mothers there, it's not their fault because growing up, that's all they know. And it limits their understanding, it limits their knowledge, it limits their access to health services.
You just mentioned something, limits their knowledge. And I believe that, when someone is knowledgeable in this aspect, when there's awareness of the effects of such practices, in the lives of mothers, I believe they will take a better route, to protect themselves and, of course, their unborn children. We'll be going on a short break now. And when we return, More Cafe will take us through social commentary. Stay with us.
Culture connect us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
Celebrate
and preserve the arts and culture that define us.
Welcome back. If you're just tuning in, this is Timeline on More Cafe. Over to you.
Yes, so we've been talking about maternal mortality across Africa. So let's go take a look at what's happening on social media and what people have been saying about maternal mortality. From Emma, she says that 710 babies delivered at home in Epworth, Harare. Maternal health isn't just a women's issue. It is a human rights issue and a societal priority. The health of mothers shapes the future of our communities. Mm-hmm. What do you have to say?
Well, it's no news, because if a woman dies, different people lose something. You can lose your mother, someone loses her husband, another person loses their aunt, another person loses their staff, a teacher, all of that. And all of those things are contributing factors to societies and communities. So it's very, very essential that maternal health is seen as a human rights issue, as the person said. It's very, very important that we look at it from that lens, because when a woman dies, it's not just somebody's mother. Different relationships are lost at the same time.
These are farms what Sharon said earlier, that whether you're a woman or not, maternal mortality affects all of us. Let's look at the next one. This is from The Economist, and they say that improvements in maternal health have stalled in recent years, partly as attention shifted to issues such as climate change, but the problems are related and things can be done to help. What's the correlation between climate change and maternal health?
When it comes to climate change, I actually like this topic because it happens every day to us, especially us in sub-Saharan Africa. Climate change is the irregular shifting weather patterns over a period of time. So what happens when we have these irregular shifts in weather patterns? We have more droughts, we have more flooding, we have heat strokes. And some of these heat strokes can be a hindrance to these women, especially in rural areas. I always go back to rural areas in accessing health care, because if the sun is too hot, or if the temperature is too hot, and her regular means of transportation is a motorbike, she would not, even if she's supposed to go for antenatal care or something, just because of how the temperature is, she wouldn't be able to go out, because it can make her more sick, it can make her more tired, it can give her heat stroke. Another thing is flooding. When these floods happen, these primary healthcare centers are highly affected. Some of the staffs don't get to go to work to attend to the mothers. Some of the equipment are lost. Some of the buildings are destroyed. Another thing where climate change comes in when it comes to maternal health is nutrition, the maternal health nutrition. So when it rains, or when there is flooding, and when there is drought and crops don't grow, or farmers don't go to the farm, or traders don't go to the market, some of these women cannot access the adequate nutritional needs they require for themselves and for their babies. So those are some of the ways climate change can affect maternal health.
So in a way, it also shows the inequality that maternal health mortality brings out as regards the rich and the poor. Amazing. Now let's look at our last social media commentary before we call it a day on this particular segment. This is from Ella, and she says, contraceptives matter because reproductive choices affect entire societies. healthy spacing of children contributes to improved maternal health, reduced infant mortality, and enhanced development outcomes, proving the impact extends far beyond individuals. But yet, contraceptives are seen as sin in some places, is it not?
Yes, especially in very remote areas. People see contraceptive as a blockade to God giving them children. Oh, God wants me to have this child, or God wants me to reproduce 10 children. So me taking contraceptive is against God's will, which is very wrong. As the comment said, child spacing is very essential to be able to provide a child with the quality of life they deserve. And even in urban areas in Nigeria, getting contraceptives are frowned upon, which they always forget that it plays a very big role in maternal mortality, because even some women feel like, in fact, let's leave the women, the men, some of their husbands feel like their wives should not be on contraceptives. Like, there was one time in the primary healthcare center where a woman came in to secretly to get the implant contraceptive. There's an implant contraceptive method. So she secretly came in to get it. Even there was a time where I was distributing condoms, and some of them were like, oh, my oga will not use it. My husband will not use it. He doesn't use such things. So all of those perceptions that they have are really wrong, because it's very essential. Child spacing, not just for the quality of life for the child, but also for the health of the mother. I'm not against women having as many children as they want to, but if they are seeking medical and professional advice as to how they should space the child or how frequent they should have children, fine. But for those that aren't and are just giving birth like that without any advice, it's really wrong, and they should be able to sit back and reflect as to, first of all, the quality of life and their own health and the health of their family in general.
Interesting. The Sustainable Development Goals aims to reach at least less than 70 deaths per 100,000 live births by 2030. So that is the aim that they are looking at. And of course, this cannot be achievable if we do not talk about preventive measures to help decline the maternal mortality rates, especially in sub-Saharan Africa, right? And that leads me to the next question. What are some preventive measures that we can, put in to just reduce the rate of maternal mortality?
One of the first things is to create awareness. Even as much as people have been creating awareness from time immemorial about maternal health in rural areas, in urban areas, there's still a lot that needs to be done. So first, I'd say creation of awareness. Another thing is to provide maternal health insurance for women to reduce the cost of out-of-pocket payment for them, because some of them don't go to the health center or don't go to the hospital because they can't afford the bills. They can't afford to pay everything they're being asked to pay. So maternal health insurance is another thing. So when it comes to the aspect of climate change, I would encourage the government to have more emergency preparedness for when these disasters happen. When these disasters happen, they should be more prepared, they should be more equipped, and they should be ready to provide these women and also the health facilities with the support they need to access and be able to deliver care at the same time. So those are the three major things I would say. Another thing I'd say is more funding for primary healthcare centers, in which I know that the red letter brought up, but we need more funding for primary healthcare centers, hospitals, especially primary healthcare centers, because they lack equipment. The infrastructure is really poor in most of if not all, the primary healthcare centers in Nigeria. So more funding, creation of awareness, maternal health insurance, and emergency preparedness.
I like that. She said emergency preparedness. When you go there, most times what you get to find is probably first aid, but you don't see that there is available light, or there's available water, or there's an available skilled attendants present at that place, because certain factors, these basic factors, are not readily available in most of our primary healthcare systems, which is supposed to be essential, considering the fact that I earlier mentioned that PHCs are supposed to be, a source, a point of call for every single individual on our earth today, because it's supposed to help with universal health coverage. Now, if we do not have PHCs that are functional, or if we don't have PHCs that have the appropriate facilities or have the ability to attend to emergency situations like pregnancy, like childbirth, then we have a problem in our country. But now we're looking at solutions. So let's go straight into that. Imagine you're in a place where you can make policies that will be implemented in not just Africa, but globally as regards maternal mortality. What's that? What would you give?
I think one of the first policies I would establish is the Maternal Health Insurance Act, or something around that, because it's one of the essential factors required to improve maternal mortality or improve maternal health in Nigeria. Another thing is to shift out or draft policies that include primary healthcare centers when it comes to their funding. This particular year, this part of the budget goes to primary healthcare centers, or this particular year, this amount of equipment go to primary healthcare centers. Another policy that I think I forgot to mention, one of those is upskilling or building the capacity of health professionals in primary healthcare settings, because sometimes most of the skilled birth attendants in the health facility or the health professionals that are there, some of them don't know what they're doing, and some of them are underskilled. So we need to build their capacity to be able to attend to these women, or to be able to give out the care these women need or require. Another thing is implementing education or awareness programs in rural areas. As much as it has been done, it still needs to be done more, because there are people who do not want to let go of the beliefs they have that going to the hospital to access healthcare is wrong. So creating awareness is very, very essential. Maternal health insurance, and building the capacity of the health workers in primary healthcare centers.
Definitely. Thank you once again, Juliet. This has been such a remarkable, conversation we've had. Well, we are wrapping up, and I would just like to throw a last question. What timeline are we? Because there's one thing to say, okay, the SDG is trying to see how we can achieve less than 70 deaths per 100,000 live births. But what is our reality? What timeline are we as of today in Africa specifically?
So in Africa specifically, we haven't gone anywhere good yet, but we still have 5 more years till the end of the SDGs. So a lot of work can be done, and this work doesn't even require so much. That's the thing. The things that need to be done are just very menial, like the creation of awareness. It's something that can be achieved, if not in a year, in 2 years. The provision of equipment and funding, it can also be achieved from private sectors, government, all of that. It can be achieved. It's a very sad place that we're in right now, and we haven't improved, we haven't moved forward yet. But I still have hope that we should, or we would, before 2030, if all of these things are taken into consideration.
Yeah, definitely. Thank you once again.
Thank you.
Well, that's where we draw the line on timeline. Remember, the maternal health is so important, and to be able to have a declining rate in the mortality of maternal mortality, we have to come together as communities, as government, as individuals to make this work. I remain your host, Sharon Ajay.
And I'm Hannah Omokafe-Dennis. Maternal mortality is a general problem. It's not just a women or a girls problem. So we all have to, put our hands on deck to ensure that this goes away.
Until next time, see you again.